All right, well, welcome back to my channel. This is Dr. DuPont, and I'm a board-certified gynecologic oncologist, and today we're going to talk about screening mammograms. So last time we talked about the self-breast exam, and while a lot of our national guidelines in the U.S. don't recommend self-breast exams, I've seen so many women over the past 20 years, and women with breast cancer, I often will ask them, how did you find your cancer? Was it the mammogram? And so many times they tell me they found it on their own. They were, taking a shower and they felt a lump, or they had a partner that felt a lump. So I do recommend self-breast exams. But today we're going to talk about mammograms. So what is a mammogram? So mammogram is a low-dose X-ray that looks for breast cancer. There's two types of mammograms. One is the screening mammogram, and the second is the diagnostic mammogram. Now, how they're different is that the screening mammogram really is done when there's no symptoms. It's just routine surveillance for breast cancer. The diagnostic mammogram is done if the screening mammogram is abnormal, or if you or your doctor or your healthcare provider finds a lump or some other breast issue. So usually the diagnostic is done for problems. Now in the United States, most screening mammograms are covered with the routine kind of wellness exams every year, but the diagnostic may or not be covered, or may have a larger copay. So just keep in mind that there are two different tests and they are looking for two different things. The screening mammogram usually just does two views of each breast, and what the radiologist is looking for is if something has changed. Now, one thing I do tell my patients is that wherever you go for your mammogram, try to stay in the same location. So we have a lot of breast centers where I live in Houston. There's almost one on every street, it feels like sometimes. But what I tell patients is try to stay at one facility so that they can compare your mammogram year after year. It is helpful. Now, if you're someone that may be moving, try to get your images on a disc before you leave, just so that the new place will have your old images. A lot of the radiology centers will call and request those images, but it is helpful if you know you're moving, just to get a copy of the CD and take it with you. So why do we do mammograms? So the purpose of the mammogram is to detect breast cancer. We do know that if it's caught early, it's actually able to be treated very easily. We know that 1 in 8 women will get breast cancer in the United States. So I tell patients, if you're in a room with 8 women, one of those women will get breast cancer sometime in their lifetimes. Now, for African American women, cancer is actually caught at advanced stages, and a lot of times more aggressive. Breast cancer is one of the most common causes of death in Black women, so we definitely want all women to get screened. Now, when should you start screening? I usually advocate for age 40. Now, there's different guidelines in the U.S. with different ages. I usually go by the NCCN guidelines, which is a National Comprehensive Cancer Network, and they do recommend screening mammograms every single year after the age of 40. There are other guidelines that say between 40 and 50 you can go every other year. What I usually find for women, if you don't do things routinely, I'll have patients that will go every 2 to 3 years, or they'll forget when they last went. So I try to advocate for my patients to have it done every year. And then also will tell patients to try to get it in their birthday month. So, if your birthday's in June, just have your mammograms in June. It's just easier to get everything done. It seems like people don't forget as often. And so once you've had the mammogram, typically the doctor will go over your results, or your primary care provider, and the radiology center will usually send you a letter in the mail just telling you, if it was normal or abnormal. And so some of the signs of breast cancer that are really important to know, and that usually most women really know that something's abnormal, is if there's a lump or a mass or something's changed. So I find that if you do your self-breast exams routinely every month, and I usually will start my patients actually at the age of 21 just doing their own self-breast exams, mainly because I want them to get to know how their body feels, so over time if things change, I want them to be able to detect that. So some of the symptoms besides lump are swelling in the breast, redness, pain, changes in the breast shape or contour, and then discharge from the nipple, whether it's milky discharge or bloody discharge. Those are things that you should let your healthcare provider know, because those are things that we look for in terms of, there's something not right or something abnormal with your breast. And then once you've had that, then we usually would advise some type of imaging, whether it's an ultrasound or a mammogram, depending on your age, and then what your provider recommends. But I do find that once you have found something abnormal, definitely pay attention. I have had some patients over the years that had a normal mammogram, and then a few months later they felt a lump. Now some patients think, oh, well, my mammogram is normal, I'm not going to worry about it. Well, the mammogram is not perfect. It can miss some masses, so I want to make sure that you recognize that if something is new or something's changed, even if your mammogram was normal a few months ago, let your healthcare provider know, because the mammogram can miss some masses, and some masses aren't picked up well on mammograms. Sometimes we have to do ultrasound, sometimes we have to do breast MRIs. So we talked about starting screening at 40. Now there are some women that need to start screening sooner, and those are women with a strong family history of breast cancer, like in a first-degree relative like your mom or your sister. You might need screening earlier. Sometimes my patients, I'll tell them start screening 10 years earlier than your sister's breast cancer or your mother. So definitely talk with your healthcare provider, because they can give you guidance in terms of when to start screening. And then the other population that we may screen sooner is patients with a gene mutation such as BRCA1 or BRCA2. There's a lot more hereditary breast cancer syndromes and ovarian cancer syndromes that we're learning about as we do more genetic testing on women. And so if you're in that high risk group, then you may need screening every 6 months. Sometimes, in patients with BRCA1 or BRCA2 mutations, I'll get imaging every 6 months, where they'll get a mammogram once a year, and then they'll get a breast MRI once a year. So just keep in mind, if you're in a high risk group, you may need screening more often. And then the other thing is, when do we stop screening? So I've had patients, like this year someone was 90 and was diagnosed with breast cancer. So typically, if you're expected to live more than 10 years and you're in good health and you want to be screened, then we still continue screening. There's really no cutoff, a certain age we stop. It just depends on your overall health. And then I tell women, if I order this mammogram and there's something found, do you want anything done? Sometimes there's women that don't want anything done. So if there was an abnormality and you don't want treatment, then there's no reason to do the mammogram. So there's lots of reasons that we stop mammogram screening, but definitely the health of the patient is very important. So if you're in poor health, then the mammogram may not be something that your doctor would recommend. But definitely talk to your provider about when to start screening, how often to do it, and then when to stop, because it is different depending on your personal situation. But I do want you to remember to get your mammograms if you're over age 40, because it is important, and we do want to be able to catch things when they're easy, when they're small, because I tell most patients that it's easy to treat things that are small, stage 1, so much easier than when it's advanced stage. All right, so that's all I have for today on screening mammograms. So definitely make sure that if you are over 40 that you do get your mammograms. If you have any questions, you can definitely put them in the comments below. If you have any stories you want to share with others, definitely put them in the comments below. And remember to take care of your health. All right, I'll see you next time. Thank you. Oh, and don't forget to subscribe.